You're listening to Vet Synapse, a podcast connecting the world of research, innovation, and practical help to the veterinary profession. I'm your host, Dr. Philip Judge from Vet Education. Let's get connected with Vet Synapse. Welcome everyone to another episode of Vet Synapse, and I'm very happy today to be speaking with Dr. Sasha Nefedova, who is the head of commercial at Vet Chat. It's a telemedicine company run here in Australia, a big telemedicine company. Dr. Sasha is going to tell us a little bit about that in a second, but before I hand the microphone duties over to you, I'll tell you a tiny bit about her. She has been in the veterinary industry for nearly 20 years. She graduated from the University of Melbourne. She spent time in general practice as well as emergency and critical care practice as well. She's a passionate teacher. She's been a sessional lecturer at the University of Melbourne, teaching veterinary students, as well as Melbourne Polytechnic, teaching veterinary nurse students, and she is involved, as I mentioned, with Vet Chat. Sasha, welcome to the podcast today. We're going to be talking about telemedicine, but before we get there, I'm just wondering if you can tell us a little bit about your journey as a veterinarian to fill in the gaps that I've left and how you ended up where you are now.
Thank you for having me, Phil. Really excited to be here. Look, I've had a very diverse journey in my vet career. I started off in GP practice in what used to be a remote and regional town and now has been swallowed up by suburbia just outside of Melbourne, and did emergency and critical care for 4 years, which was a really formative time for me. I really enjoyed that. I've worked in some management roles since then, and I've known the CEO and founder of VetChat for many years, Dr. Claire. Dr. Claire founded VetChat basically in her living room, really wanting to have better access to care for all pet owners. And I've really resonated with Dr. Claire's, ethos over the years and started with VetChat just recently. So I'm really excited about teaching as well. And I have spoken about Tele-Health to a couple of vet clinics already. Everyone's very interested to learn more because we know that it's happening, we know it's growing. We might not know a little bit more about the detail of what it actually involves.
Great, and I think we want to explore a little bit about that detail today. So, what exactly is telemedicine in the veterinary sphere, and how does it fit into the spectrum of veterinary care that we work with?
Yeah. So look, a bit of a long answer from me, Phil. So bear
Of
with.
course.
Um,
Yep.
I think it's good to talk through some basic principles first, and then have a look at telehealth through the optics and the lens of the vet world, and then also the client's perspective. So, broadly speaking, telehealth is an overarching term within which we have two pillars, which is teletriage and telemedicine, and they are different things. Teletriage is the safe and effective assessment and management of pets via remote consultation. And it basically means that we tell the pet owner if there is an urgent issue and if hands-on care is required. And if it is required, when they need to be seen. We might revisit this point a couple of times throughout our chat, Phil, because that's really important. Clients don't know a lot of information. We know a lot of information because we're vets and we've had years and years of training, but they really don't know what to look out for and when they can be seen. And if they don't have access to a car or a way to get to the vet clinic, having that information is very helpful. So that's teletriage, and that's what VetChat specializes in. And that's what a lot of us vets are doing anyway when we pick up the phone and have a quick conversation with a client and tell them when it is that they need to come in. It's actually quite known within the vet industry already. Telemedicine is the practice of veterinary medicine remotely. So it is also teletriage, but it can and does involve diagnosis and the prescription of medications. And that's a little bit more vague in the Australian landscape. And there's a couple of key principles that we can delve into later. But again, telemedicine, different to teletriage, and teletriage is really what VetChat specializes in. So then when we talk about this from the spectrum of care perspective, obviously that's becoming very topical. I'm in Melbourne, so I'm registered in Victoria. The Victorian Vet Board do a great job communicating with vets about things that are evolving, and the spectrum of care has been very topical in the recent months to a year. Gold standard practices becoming less of a focus and more of a focus on the entire, all the things we need to think about for that patient, the client factors, the patient factors, financial factors. We need to put all that into account when we give medical recommendations. And telehealth slots beautifully into that because it gives people access to care that is appropriate for them. to then have a well-rounded approach to how they treat their pet and how they communicate with their hands-on care vet. Telehealth will never replace hands-on care. It complements it, which we'll talk about with some cases a bit down the track, Phil. But it definitely aids that spectrum of care. And then from the client's perspective, it's definitely becoming more of an expectation. So VetChat actually published a telehealth report that's available on our website, and we found that 13% of Aussies had tried Vet Telemed, but 81% would consider using it in future had they have known about it. And about 25 to 30% of Aussies had used human telemed. So because they're using more in the human space, they're understanding more in the vet space, and once they use it, they really like it. So the expectations are becoming higher in terms of using it in future.
Great, thank you for that information. I want to zero in on a couple of things that you mentioned. You mentioned obviously tele-triage as part of the overall telehealth spectrum, but what other sorts of consultations or cases can telehealth consultations be used for? For example, behavior, post-operative care, advice, dermatological problems, behavioral problems, other things as well. Is there a limit to the spectrum of initial consultation that can be provided?
I wouldn't say there's a limit, but there's a couple of consult varieties that are very common and that are very adept to telehealth. So within VetChat, for example, about 20% of our consults are gastrointestinal. So again, coming back to that principle of clients don't know things, an adult dog that's vomited once versus a geriatric patient that's vomited 3 times, that's also PUPD, versus a deep-chested, barrel-chested dog that's dry-retched 3 times are obviously very different cases, but clients don't know that information. So having access to a vet straight away to understand, is it urgent, and if so, when do I need to be seen? Really useful for gastrointestinal cases. Another really useful one is quality of life conversations. So they're obviously very delicate conversations. People are often heightened emotionally. It's useful for them to be in a comfortable home environment to really listen to what their vet's saying. We all have a spiel, Phil. I'm sure you had a spiel. I had a spiel. Write down 10 things your pet loves to do. And once they can't do 9 out of 10 or whatever the number is, then potentially it's time to say goodbye. Having that in the comfort of their home, where their pet is also comfortable and can be potentially visually seen by the vet, is also very helpful. And I guess, yeah, in that same vein, as you mentioned, behavioral consultations, very useful to have via a telehealth model. You can observe the pet in their home, observe their behaviors. For cats, see where they're toileting, see exactly where the litter trays are placed. That's all really important pieces of information. Multi-pet households, where is their bedding placed? Are they close to each other? Is there a fight for resources that maybe the client's not picking up on that you can see through a video model? And yeah, just giving people the opportunity to have that consult without driving to a clinic if it's particularly difficult for them also makes a difference. The other one we have quite commonly, Phil, is medication queries. And that's also another really useful telehealth consult type. So I've given my dog its first dose of gabapentin. It's really sedated. Should I give the next dose or should I wait a little bit longer? Really common question. Diabetics is really great as well. So, stable diabetic, I've been giving insulin for X amount of years, but just vomited a couple of times. Should I give the next dose or should I go and see my vet first to get some testing done? I've accidentally given one pill instead of half a pill. What do I do? All those kind of questions with, vet advice is really helpful and really alleviates the stress and the burden that client's feeling.
Absolutely, and the stress and anxiety that some of the animals have as well. And you mentioned behavior, and that can tie in with pain assessment as well, because we know that sympathetic nervous system activation, which naturally occurs in both dogs and cats when they're put in a car, taken to a strange place like a veterinary clinic, can suppress, or in some cases exaggerate, but a lot of times it can suppress behaviors which in the home environment may be recognized as painful behaviors. And you're going to be able to see that on video in the telemedicine consult.
100%. And Phil, I might actually just give you a case example that we literally had a week ago. So we had an 8-year-old male neutered Labradoodle that had gone to the regular vet and was Losing weight seemed off, but not entirely clear what's going on. Ate treats in the consult room, wagging his tail as Labradoodles do. And then when the client took him home, absolutely flat as a tack, hypersalivating, behaving very differently in the home environment than they did in the clinic environment. So almost like a white coat effect for a Labradoodle when they went to that consult. They had a vet chat consult via video. The vet chat vet could see how flat the dog is and suggested, like, really, you should do some diagnostics. We don't know exactly what's wrong, but you will need to do a workup. You will need to commit some resources to do the workup. But I think you should do it because I agree that patient does not look well. Had a chest x-ray and had a bone fragment in the esophagus. So
Wow.
really tricky one. I don't know if you've had these over the years, Phil. I actually had one as well. We're still eating treats, still going around that bone fragment, not necessarily vomiting or dry retching because it was quite further down, but
Mhm.
having these nondescript symptoms. And it had a scope, had the bone fragment removed, and was really, really well afterwards. So a really good case example of telehealth complementing bricks and mortar care and eliminating that white coat effect or kind of discerning what impact it's having to the clinical outcomes.
So we've spoken a bit about the spectrum of where telehealth and both teletriage and telemedicine consults can be applied. How can this sort of service be applied to a bricks and mortar veterinary practice? And I'm thinking, can veterinary practices utilize telehealth in their everyday practice to sort of help with workflow when things are very, very busy, if they're in surgery, those sorts of things? Tell us a little bit about some of the applications of telehealth in veterinary medicine as you see it right now.
Yeah. Look, I think in short, yes, it absolutely can be done by bricks and mortar clinics, and it already is being done. I think COVID had a lot to do with the uptake. So, certainly a lot of the new PIMs are coming out with modules that are already plugged into the software. So, EasyVet, as an example, has that. So, if you're in your normal hospital, you want to do a telehealth consult, you can just click the Zoom function. You've got all the patient details, all the consult notes there to refer to, all the notes you type go straight to that patient's file. So, technologically, it's quite simple, and there are already off the shelf packages available for clinics to use. Things that are very useful in a bricks and mortar clinic for telehealth would be things like rechecks. So,
Hmm.
coming physically to a hospital is a burden for some clients. Maybe the cat doesn't like to be transported, putting the cat in a cage. Things that don't require necessarily a hands-on visit but can be visually assessed. Or again, questions about medications. If you have a video consult, you can see the skin and you can have, a long-term patient that's been on chronic meds that you want to tweak doses to. Some of those consults can be done remotely. And it will
Hmm.
just mean that you have greater touch points and the client's happier and they will keep going to those rechecks and you can still be remunerated. Post-op care, really useful that you can do via telehealth. Again, you can visualize the wound. If the person doesn't want to come in or they can't come in, that's a really good use case. And behavior as well. So, any behavioral consults that you do, people are calmer, you can visualize the home environment. And again, it's all connected in your software. Probably the only thing I would say is that if you do want to start telehealth in your practice, do it thoughtfully. So consult with your vet board, consult with your software provider, consult with your team about what they can and can't do and what they want to do, because communication is extremely important. And, some vets that are amazing vets in a hands-on environment might not be as comfortable in a telehealth environment where you don't have social cues or, physiological cues from the client are diminished. Communication's really important. We need to have a back and that ongoing communication style. We call it the frisbee. So you say something, I say something to really build that trust and rapport with clients. So think about maybe doing some extra CPD and training for your vet team if you do want to put it in place because it's very important.
Right. What about companies like VetChat? How do you support the bricks and mortar veterinary practices? As we know, cases come in into the hospital, particularly emergency cases, but even something that you might triage as a triage class 3 or 4, they still occur from time to time, right? There's skin irritations, lameness, those sorts of things, and they don't only occur during working hours. So how do telehealth companies like VetChat assist bricks and mortar veterinary practices in their day-to-day working?
Yeah. So we have probably three main ways that we assist clinics. So the first kind of category is clinics that offer after hours. So mixed practice, rural regional clinics, if that's what they're doing already, having vet chat vets triage that call to begin with has many, many benefits. So it reduces the overall call volume to the on-call vet, so they get to have a bit more of a rest. Clients are more equipped with information when they do reach the on-call vet, so the communication is a lot smoother. They've already had a prompt that, yes, you probably will need to come in. Yes, it will cost this amount of money, but you really need to be seen. I suggest that. And then the vet on call can obviously have that conversation. And in vet chat specifically, we have a two-way communication with our after hours clinics. So if you're an on-call vet in a mixed practice and you're going to a colic or doing a cesarean, you're not available for a couple of hours. That on-call vet then speaks to the vet chat vet and says, I'm not available. Please manage my calls in a certain way to make that night shift or after hours shift a little bit smoother for them. And you and I are emergency vets, so we know that that's very important to have a little bit of structure and planning and support, extra support.
Absolutely. Yeah.
Yeah, so that's the after hours clinics. We also support a lot of smallies metro clinics that refer to emergency centres. And the point there is to give their clients access to vet advice that they can opt into at all times. So the trigger is not just go to emergency or nothing else. They've got another option at another price point that that client can choose to pay if they want just any vet advice for anything that's happening to their pet, and then essentially get them to come back to the clinic when appropriate. So if they can't get to the clinic for 2 or 3 days, having that assurance that it's actually okay to wait until then is really important. So it's giving their clients extra access to care. And the third way that we support clinics is peer support. So we have Australian and New Zealand vets that work with VetChat quite a lot. And we all of our vets have a minimum 5 years clinical experience. So we do case support for new and recent grads, but it can really be any kind of vet. And that involves phone or video support, really helpful for, again, as a new grad when you're learning, you probably have had the same experience, Phil. Learning in real time is so important and it really formulates that long lasting education. And even if it's just reinforcing what the new grad has already done, really builds those skills. So the vet chat vet will review x-rays, give support, make some suggestions of what the treatment can be.
Great. Sometimes it's that bouncing of ideas off another person who's experienced and well qualified can make a huge difference. And it's the sort of thing that I think many of us, certainly me, who I graduated when dinosaurs were still in the waiting rooms, but the if we'd had that sort of support when I was a new grad, it would have just been amazing, to be able to actually have that collegial support in that sort of manner. So that's fantastic as well. How about prescription medications? You mentioned review of prescription medications in with regards to analgesics, those sorts of things for post-operative patients that you might be able to use with regards to telehealth. What about if you are consulting for a client and you feel that a patient would benefit from medication A, B, or C? Is that something that is done or requires a physical visit to a vet clinic to be able to do?
So, broadly speaking, that requires a physical visit to be able to do. So, like we said before, we've got telehealth, of which there's teletriage and telemedicine. So, telemedicine involves the prescription of medications. And the key part to that, Phil, is the veterinarian client patient relationship. So, the VCPR. Of that, there are three things or three conditions that need to be met. And these are fundamental principles that kind of apply across all states, although the state regulations are very different. The three fundamentals are that the vet is in charge, the vet is in control. It's the vet's responsibility about what's happening to that patient when they are doing a VCPR, a veterinarian client patient relationship. That's point one. Point two is they should have had a physical examination and have access to that patient's medical records. And the third point is there must be follow-up care available. So it's not good enough to just do a telemed consult and then that person has no capacity to access hands-on care afterwards, should something else happen. So they're kind of the fundamental principles. The state vet boards are quite different, so it is a little bit murky. So I think if anyone is interested in doing that in their own clinic, again, the best advice is to consult with their vet board and get that specific advice for them, their own region, around what is appropriate and not appropriate. But that's the fundamental principle of how it works.
Perfect. Thank you so much for shedding light on that. Is very, very important to have that clarity around that as well. Now, I want to switch focus a tiny bit to find out about the sort of person that wants to do telehealth and telemedicine in the veterinary sphere. I know that you have got a lot of veterinarians working with you at Vet Chat. Tell me a little bit about the people that really like this sort of work, what drives and motivates them.
Yeah. So at the moment, we have over 70 Australian and New Zealand registered vets. About 80% of our workforce are also working in clinic and doing vet chat. And
Right.
it's actually really timely that we're having this conversation because we just did a team survey just recently, and our vets basically said that, what motivates them to work at Vet Chat, what inspires them, what's the purpose and the reason why they do it, and it's helping pet owners in stressful moments. It
Hmm.
sounds really simple, and I guess we have a bit of a skewed perspective when we work in a clinic because the consults are planned, the people are coming in, we're obviously treating them as we go. We don't see visually the stress that people experience when they're at home and it's 10 o'clock at night or 3 o'clock in the morning and they don't know what to do. Just referencing that telehealth paper that we published, Phil, VetChat published, 97% of pet owners said that when their pet is unwell, it impacts their mental health. So our vets love the fact that they are able to give that advice in that exact moment and alleviate that stress that pet owners have. That's something that they specifically listed. They also listed being there for people in rural and after hours situations, so really supporting our workforce and our industry. The AVA's published some information recently that we're now in our ninth consecutive year of the vet workforce shortage. So it's a compounding issue for us. Having access to vet support just redistributes the resources that we do have better and really alleviates the mental health strain on rural and remote vets and reducing the load on in-clinic vets in general. So even if they're not in a regional location, just having that extra support from trusted vets is something that our vet chat vets really care about, and it drives them.
That's great. And it is, I can speak from personal experience. Consulting with vets that I know who work in rural practice who are alone driving from one property to another, and they want somebody to speak with to sort of bounce ideas off. They're helping your colleagues in that way is tremendously rewarding, and particularly when you get follow up. And that's something I might just ask you about in a second as well, is about the follow up with the clinics, because I think that's quite important for both sides as well. But you also mentioned helping those clients out in times of deep distress, and you've worked in emergency medicine as do I, and we know how stressed clients can be at all hours of the night because animals get sick all hours of the day and night. In fact, sometimes their worst illnesses they're uncovered at nighttime because the owners are often away during the daytime, and it is tremendously stressful for those owners. And to be able to help them early on is often very, very helpful in terms of just helping re-engage the cerebral cortex, less reliance on the limbic system for that flight, fright response from the client, so
Yeah.
that they're better able to rationally deal with the situation. But you know as well as I do, if your own pet is sick, it's even though we're veterinarians, it's an immensely stressful time. So I think that the fact that there are these services available is of tremendous benefit to those people.
We always joke in clinic about everything happens on a Friday night, right? So someone's
Yeah.
client's left the pet for 3, 4 days and now it's critically ill. And obviously that's a frustration for us, but there's reasons why people do that.
Hmm.
Obviously, there's some sort of barrier to them, whether it's mental or physical or financial or conceptual, whatever it might be.
Mm.
Yeah, having that access really removes that. I might actually quote a piece of literature, Phil, if that's okay, just on
Perfect.
your point there. There has been quite a bit of literature on veterinary telemedicine and specifically that impact to clients. Roker and McCarthy did a study in 2019, so quite old, on the impact of telemedicine on the traditional veterinarian client-patient relationship. And what they found is during follow-up, owners felt better informed 89% and better
Hmm.
able to communicate 86% with their traditional care vet. So it's also
Great.
that piece that we're talking about that they've had a chat to a telehealth vet, they've absorbed the information, they've engaged their learning system, they're not in flight or fight anymore. Then when they do see their hands-on care vet, they know what to ask. They've pre-thought of questions that they might need to know answers to in really high volumes, in really scientifically impactful ways, basically.
Yeah, that's great. And I guess as well, speaking at this from an emergency vet perspective, I can see advantages of clients actually having had a look around their property, for examples of toxins that their animal may have got into, rather than trying to recall and then going home and then reflecting and having to phone the clinic back. We can start, interventions perhaps in a more meaningful way if we have that information a little sooner as well. So that as a triage perspective, I could see advantages there as well.
Absolutely.
Talk to me a little bit about the communication between telehealth and bricks and mortar clinics. How does that work? And is it a two-way communication? Do you get follow-up from the animals when they go back to the clinic so that your vets find out what was going on after they initially took the call? How does that all work?
Yes. So for vet chat specifically, like I said, if we have an on-call vet clinic, we
Hmm.
communicate with them back and forth throughout the shift if they need to. If they don't need to, everything's humming along, there's no issues. With vet chat, we've got quite a robust process to alert the on-call vets to calls that they need to physically see. So we follow that mechanic. And whenever we do a tele-triage consult, the vet chat vet writes notes. The notes are emailed to the client, and the same copy is emailed to the clinic and also available in a bit of a dashboard that the team can eyeball if they want to in the morning, just to see what the consults came through. We color coordinate our dashboard. So, yeah, green means they didn't need to be escalated, orange means they did need to be escalated. So, clinics can have a look at that. And it's really important that the client and the clinic have the same information sent through, because the purpose and the benefit of triage is, again, is it urgent or do I need hands-on care? And if so, when? So it
Hmm.
might be something really precise, like if they vomit two more times, then you need to be seen. If they vomit one more time, don't need to be seen. That's a bad example, but it's very specific information, and that is absolutely sent through to the clinics. Toxicities is a good one as well, where the vet chat vet will write the information. You have ingested a dose of X. You have ingested this toxic dose. This means blah, blah, blah. And then the vet the next day, or the bricks and mortar vet, can review that specific information as well. It's very important.
Great. Well, thank you so much for sharing your knowledge and all of this amazing information with us. I can see that it's that this telehealth, and I'm calling it telehealth now rather than telemedicine because you've educated me today on teletriage and telemedicine, which is great. But I can see this is such a useful thing for veterinary practices, for clients, for the veterinarians doing the work, and for the veterinarians receiving the benefit of having had that work done as well if you're working in a bricks and mortar clinic. So I think it's a really valuable tool for the toolkit that we have and need as veterinarians to be able to practice the best veterinary medicine that we can for not only the patients but also the clients as well, and providing that overall spectrum of care, circling back to what we spoke about right at the start of the podcast today. So if people want to know more about telehealth or about vet chat, where can they get in touch with you?
So phone or email is fine. Sasha@vetchat.com.au is how I can be reached by email, and absolutely happy for anyone and everyone to contact me. If you're interested in telemedicine broadly, if you'd like for us to do a CPD session for your team, or you just want more information, please reach out.
Thank you so much. I know you've got a very, very busy schedule, so I really appreciate your time today, Sasha, and all the information that you've been able to share with us.
Wonderful. Thank you, Phil.
If you'd like to hear more of this podcast, why not become a Vet Education member, where you'll not only get access to podcasts, but our entire webinar library, plus a huge general library, special offers, discounts, and a whole lot more. Check out the website veteducation.com for more details.